Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
GraceMed Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at GraceMed, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. GraceMed Health Clinic, compassionate care for all.
Welcome back to another episode of our podcast. I'm here with Shelley with the Health and Wellness Coalition. Hi, Shelley. How are you?
I'm doing well. How are you?
Good. Tell me a little bit about yourself.
So I am native Wichitan. Grew up in West Wichita, just down the street, went to North High. And my degree is in exercise science, but it has an emphasis in health promotion.
Okay.
And for the past 10 years, I've been doing grants, public health promotion work.
That's awesome. How did you get involved with the Health and Wellness Coalition?
So it was through my job at the Sedgwick County Health Department.
Okay.
At the time, I was the worksite wellness health educator,
Oh, wow.
which was the best job in the world because I got to offer worksite wellness to any company for free in Sedgwick County.
That's awesome.
And so the Health and Wellness Coalition, one of the things we do is put on an annual worksite wellness conference. And so I was really involved in that and just helped from my role at the health department with the Health and Wellness Coalition until I transitioned to just working with the coalition.
That's awesome. Tell me a little bit about the coalition. Like, when did it start? What's the mission of the coalition? Just things like that.
Sure. So we are actually celebrating our 20th year.
Congratulations.
Thank you. We started in 2004. Unfortunately, I say we're one of Wichita's best kept secrets because unfortunately, I tell people about the coalition. They haven't heard of it, but thanks to you, we're going to get the word out a little bit more to some people. So our mission is to promote physical activity and healthy eating for every generation in the greater Wichita area. Awesome. So we do that. The rest of our kind of tagline is we do that through people, programs, and policy.
Okay. What programs do you have that people can participate in?
So we just wrapped up Walktober. That's an annual event that the Health and Wellness Coalition leads, but really our community partners come together and help with that month-long celebration of walking in Wichita. And we're already gearing up for Bike Month in May. And then since the pandemic, we've, kind of changed our focus and we have a few less programs because our staffing is a little bit different. But in the past, we've done a We All Eat event that inspired people to eat healthy. Awesome. We've done food tours and just trying to promote healthy eating and physical activity.
That's awesome. At GraceMed, we are definitely trying to always promote healthy lifestyle. Some of our patients don't have insurance or come from low income. How can individuals like that participate in your coalition or in programs that you have?
Yeah. So one thing interesting about the Health and Wellness Coalition, we are just a group of passionate people that like to promote physical activity and healthy eating. And so we don't really do a lot of direct service. We offer those programs that anybody can participate in. But what we are able to do is we bring in grants. So for example, Wichita was selected as one of 8 communities in Kansas for a Food Secure Community Initiative.
Wow.
And so just trying to help with some of our food security or food insecure data points that we're learning about and, just trying to benefit from that. But, for the population you mentioned, we work with other groups in the community. Like, for example, the health department has a community health improvement plan, and one of their work groups is food access. And so one of the things that the Health and Wellness Coalition did is we volunteered to host a local food resource page on our website. And so United Way has a wonderful list at 211. The Kansas Food Bank has a wonderful list at Kansas Food Source. But this is kind of everything put together. So it'll talk about summer EBT meals. I just posted about all of the Thanksgiving meal resources that are out there. It includes, we try to make it as comprehensive as possible. So like the blessing boxes, we want to add communal meals. And so that's one example of something that we do for people who might struggle with access to food.
Yeah. And I'm glad you mentioned that, because most of the time when you start a coalition, you see that there's a problem within your own community, right? What are some of the challenges or barriers that you see that Wichita deals with that the coalition really tries to help and resolve or take care of?
Yeah, well, I just see, even personally in my life, the world is kind of against sometimes physical activity and healthy eating. There's so many unhealthy food options that are available. It's so easy, just to, click the remote or whatever, not get as much physical activity. And so I think we're up against that. But, through our work, we just really believe that we want to try to provide healthy options. So, for example, at your work site, when you order in food, at least have a healthy option. So it's not all, just donuts and sugary drinks.
Yes.
And so providing the healthy option, and then prevention, with the rates of chronic disease that we have in our community, and just the research that shows that healthy eating and being physically active helps with, it could even reverse, with prediabetes, if done right.
Are there certain programs that y'all participate in that have to deal with kids? Because I know, kids love technology. Sometimes it's really hard to get them involved with some physical activity. Is there programs that y'all participate in or are involved in?
So there's lots of programs out there that we promote. So, for example, Park Run is a fun thing that's been going on in our community for over a year. It's a free weekly 5K open to anybody. So kids can participate. It's at Exploration Place. Actually, right now, as we're filming this, there's a youth advocacy coalition meeting going on. And so we try to participate in that, with the size of our coalition right now. And we want to focus on all generations. And so we're not really doing a lot for one generation, but we try to support, the senior population and kids. And so it just kind of depends on our projects at the time. Like, for example, we are in the running for a Blue Cross Blue Shield Pathways to a Healthy Kansas grant. We'll find out in December if we get that. And if we do, one of our projects is a farm to early childhood project that we're working on with Child Care Aware of Kansas. And so I just love their attitude and their willingness to get involved with us on this project, because they just firmly believe that, if you introduced kids to vegetables early on, and then if they grow it, they're going to be more likely to eat it. And so, that's a potential project that we'll be working on.
That's incredible. That's absolutely incredible. What are some of your goals within the next couple of years for the coalition?
Well, ultimately, just, promoting physical activity and healthy eating. We kind of monitor the rates of, physically active, how many fruits and vegetables people are eating through a survey called the Behavioral Risk Factor Surveillance Survey. But with data, it takes time to collect the data, and then they have to analyze the data and then post the data. So it's, a year or so out, and then changes like this don't happen overnight, obviously. So it's just, staying present, staying visible in the community, and, kind of like I said, just promoting the healthy option, reminding people about what's out there. We have so many wonderful resources in our community. Wichita Park and Rec, they have hundreds of parks and so many great programs. They're one of our great partners. K-State Research and Extension offers so much education. They're somebody we partner with a lot. So they're doing great
You've
work.
mentioned that there's like hidden gems out here in the community. You mentioned Parks and Rec. Is there anything else that perhaps the community doesn't know that you would love to talk about?
Well, I just like to share things that people don't know. So, for example, if you Google Eat Real America, the founder of that lives right here.
No way.
Her and her husband decided that they were not eating healthy enough and wanted their kids to eat healthier. And so they started, at the time, it was called Get Real Wichita, I think.
Okay.
But it has evolved to Eat Real America, and they're doing some great things.
Awesome.
So actually at our Working Well conference last year, we had over 200 people making a massaged kale salad at the same time.
Oh my gosh.
Just as an activity and,
Yeah.
education, and everybody loved it. It's a delicious salad, really healthy. And so we're
awesome.
glad we kind of took the risk with that activity because it paid off.
What would you say to those people who are perhaps listening to us in their workplace, and they're like, I want to get healthy? Like, what are some things that they could do with such a busy schedule that would help improve their health?
Yes. So I would say just to anybody that's listening, you can lead in worksite wellness at whatever position you're in. You can model healthy behaviors. You can bring in your lunch. You can pack healthy snacks instead of going to the vending machine. But then as far as and again, leading at any level as far as trying to impact the culture, but really, with human resources and upper management, just really promoting that healthy culture of work, self-care. We at the Coalition promote physical activity and healthy eating, but we know that mental health is so important for you to be physically active and to eat healthy. And, there's financial stress that goes or wellness that goes into that, because if you're stressed, it's going to affect your mental health, and you will struggle being more as physically active. And so there's just so much that goes into it. And so if there's a culture that says take a break, go take a walk, they have water for you to drink, just thinking about that. I've entered buildings before where the stairs are locked, and I get it sometimes for security reasons, but that's the perfect gym right there. Just jog up and down the stairs.
Exactly. We have this open space in our building, and we'll see randomly people just walking in circles in this open space just to stay healthy. And we're very blessed that GraceMed provides us with water, so that way we can, it's always available for us. I love that. What do you say to those people who, because we hear this a lot, is it's just too expensive. It's too expensive to eat healthy. It's too expensive to work out, gym memberships and things like that. What do you say to them?
So, I'd say that there's a lot of opportunities. You just have to get creative. Walking doesn't cost much besides a good, a decent pair of shoes.
Right.
And, weather in Wichita is kind of crazy, but you can walk in any weather. So that's easy. Most people have a smartphone, and you can get access to hundreds and thousands of videos on your phone. So just, Google it from YouTube.
Yes.
5-minute yoga, anything, cardio aerobics. So for being physically active, I would say those are just some quick tips. And eating healthy, it does take a little bit of planning, but when people talk about being expensive, I often think, when I'm at the grocery store, a bundle of celery, I think, costs like $1. And I get it that, it takes some washing and some cutting. But that in itself, and how long that would last compared to a candy bar, which is going to cost $1 or more out of a vending machine. So it's, just prioritizing what's important in your life and making time for that.
I had a friend who that was the biggest complaint, which is I have to spend so much time in the kitchen, stuff like that. She made it to a family activity.
Oh, yes.
So the kids can participate and things like that, and talk about the colors and the texture and the taste and everything. And so I thought that was a great way to get the family involved.
Definitely.
When it comes to their meal prepping, because it was just her by herself.
Exactly.
It was everyone being involved and things like that. So I thought that's awesome.
Wonderful.
Very easy to just overeat and get comfortable, and it's cold outside and you don't want to do a lot of physical activity. What would you say to those individuals who it could be a bit of a challenge?
Definitely is a challenge. And one of the favorite things that we did when I was at the health department, like I mentioned, is we would do these challenges. And so work sites could participate in. Every year at this time, we did maintain, don't gain. So just being aware, stepping on the scale right around this time. And just checking in and being aware of how many extra calories you're, taking in when you're going to these holiday parties and things like that. And I heard some really good inspiration recently. It said, follow your plan, not your mood. So I know for me, I could have a great plan, but then I think, it's windy, or it's, the cold weather's affecting my mood
Right.
and I don't follow my plan. And so that's what I'm going to try to use.
What are some things that you can tell our listeners that will keep them motivated to keep those goals?
Sure. So I am a believer in fresh starts and resolutions, but I don't think it has to just be at the beginning of the year. So set some resolutions. One of our speakers at the Working Well conference had this whole session about habits. And one of the things that was a really big takeaway for me is habit stacking. And so if there's something in your life that you are really good at, you know, brushing your teeth every morning, let's hope, you know, for good oral health, but, you know, try to stack a habit with that. So, you know, I heard this random research. If you're able to stand on your non-dominant leg for 30 seconds, it's kind of a measure of how you're doing just overall physically.
Okay.
And so, you know, standing on one leg when you're brushing your teeth to check your balance, doing some squats in the air, you know, so just you're stacking something that you're wanting to work on with something that you're already good at doing.
That's awesome. That's great advice. I love that. Before we end our session, is there anything else that I perhaps didn't get to ask or mention that you would love to mention to our listeners?
Sure. So the Health and Wellness Coalition, like I said, we just work with all sorts of great partners. And so we like to promote everything that's going on with physical activity and healthy eating. So I would encourage anyone that's listening who is maybe hearing about us for the first time to go to our website. It's hwcwichita.org and join our newsletter. So every month you'll get a newsletter, and I am guilty. I send the longest newsletters, but it's just because we've got so much good stuff going on. And so they are really long, but you know, just inspiration and tips and events going on that are related to physical activity and healthy eating.
You have a great newsletter.
Oh, thank you.
Yeah, it's
Thank you.
wonderful. And it has a lot of great information on there. So thank you so much. Well, Shelley, thank you so much. Thank you so much for taking the time to meet with us and talk with us, and for our listeners as well.
You're welcome. I appreciate you doing this podcast.
Thank you.